If you've just recently been diagnosed with a cataract, this video is for you. Hello, I'm ophthalmologist Dr. Terry Spencer, and I'd like to tell you what you can expect when you go see your ophthalmologist for an evaluation for cataracts. When you've been diagnosed with a cataract, the next part of the decision-making process is going to be whether the cataracts are bad enough to need surgery. In many cases, you were diagnosed by your optometrist, who then may refer you to an eye surgeon or ophthalmologist for further evaluation. Just because you've been told you have cataracts does not mean you urgently need surgery. Some people are eager to have it and motivated because they know cataract surgery might offer a chance to get out of glasses. Other people might not be bothered by vision loss and are functioning fine with their activities of daily living. In this case, even if you have a cataract, does not mean you urgently need surgery. It's not an emergency. The decision on whether to have cataract surgery or not is no longer between the doctor and the patient. Medicare and other insurance providers have standards for when it's time. It should be covered by insurance, just like if you needed some other surgical procedure. You don't need a vision plan in your medical insurance in order to have cataract surgery. The symptoms of a cataract are reduced vision or blurred vision and glare problems, especially noticeable while driving at night. So it's important to let your eye doctor know about this symptom as well. Glare in itself can be an indication to proceed with surgery. Every eye surgeon and clinic is going to have their own protocols, but basically you can expect at your appointment to undergo some initial testing before you even see the ophthalmologist. Your pupils will need to be dilated in order to better evaluate the lens of the eye. The lens is located inside the eye, behind the iris, the part of the eye that gives it its color. And the pupil is that little central opening in the iris that allows light to shine through. When we make that pupil bigger, we can better evaluate the lens and the cataract. Cataract simply means that your own lens has become more opaque or cloudy. There is no medical drug, vitamin, or eye drop that cures cataracts. So when a cataract is bad enough to need treatment, that treatment is cataract surgery. In cataract surgery, the clouded lens is simply removed from inside the eye, and a new replacement lens is positioned back into the same location. That new replacement lens is called an intraocular lens, or IOL. Once your ophthalmologist has evaluated your visual function and examined your eyes, they'll talk to you about the indications for cataract surgery. They'll also discuss the risks and benefits. There'll be other options to discuss with cataract surgery, and I'm saving those discussions for another video in this series. Please follow along with this series. You'll see in part 2 that I'm going to talk about what a cataract really is and why we get them. In part 3, we'll talk more about all of those options that will be available. And in part 4 of the video, we're going to talk about what to expect during your actual cataract surgery.